Hello everyone, welcome back to our channel. So in this video we will revise the lower limb topics. Those who have not subscribed to the channel, do subscribe now. Keep watching the videos. In our channel we have many playlists: histology, embryology, osteology, neuroanatomy. So do subscribe now. Keep watching the videos. Now in this class we are starting the gross anatomy topics in the lower limb. So in the lower limb, now we will start with the femoral triangle. So it will be like a revision for you. So in this picture, you are seeing the inguinal region on the front of the thigh. So femoral triangle is a muscular depression in the front of the thigh. So like this is the femoral triangle, muscular depression in the front of the thigh. Now boundaries, medially you see a triangular muscle, that is the adductor longus. So this is the adductor longus muscle. Medially, medial border of adductor longus. So you should note this, not the lateral border, because the adductor longus is sloping. So that is the medial boundary. Now the lateral boundary is this long muscle, that is the sartorius, laterally medial border of sartorius. So laterally this is the medial border of sartorius. So that is the boundary. Apex is the meeting point of adductor longus and sartorius. Are you seeing the meeting point of adductor longus and sartorius? So that is the apex. Base is formed by this ligament, inguinal ligament, which is attached from the anterior superior iliac spine to the pubic tubercle. So that is the base. So I hope you should have understood the boundaries of the femoral triangle in this. Now we will see the floor of the femoral triangle. Floor of the femoral triangle, you should start from lateral to medial. So are you seeing the lateral most? The two muscles which are arising from the lower part of the abdominal region and coming for insertion to the front of the thigh. So lateral most muscle, are you saying this is the lateral most muscle which arises from the iliac fossa, comes to the lower limb front of the thigh for insertion, that is the iliacus muscle. So that is the lateral most muscle in the floor of the thigh. Second lateral muscle is this psoas major. You are seeing it is arising from the lumbar vertebra. Again this muscle is also coming for insertion to the front of the thigh. So that is the psoas major muscle. Third muscle is this pectineus. So where the femoral vessels are situated, you can see that is the pectineus muscle. And next floor muscle is the adductor longus. So you should note adductor longus is forming the medial boundary and also the floor of femoral triangle because it is sloping. So this adductor longus forms the medial most floor of the femoral triangle. Now coming to the contents of the femoral triangle. So contents of the femoral triangle, it is a femoral triangle. So the vessels in the femoral triangle, nerve in the femoral triangle, all are having the same name. So you can see the structures in the femoral triangle from medial to lateral. Femoral vein, that is the medial structure. Next is the femoral artery and next is the femoral nerve. So these femoral vessels are enclosed in the femoral sheath and the femoral nerve is outside the femoral sheath. So these are the contents and also the lymph nodes. So they are the contents of the femoral triangle. So I think you should have understood this boundaries and contents of the femoral triangle. Femoral triangle may be asked as short notes for you, or it will be asked in the practical exams for the first MBBS. So those who have not subscribed to the channel, subscribe now so that you will continue with the next class in the lower limb. And don't forget to press the like button and share button of the video.